All right, let's jump in. Have you come across the term anaplasmosis before? It might sound pretty technical, maybe a bit obscure.
Yeah, it's not exactly a household name.
Right. But the sources we're looking at today, they show it's this tick-borne disease that's, well, much more common and frankly impactful than many people think. It affects our pets, livestock, which is vital, and sometimes even us humans.
And what's really interesting, I think, is how it works differently across different species.
Yeah.
To really understand anaplasmosis, you have to look at cattle, dogs, horses, because the bacteria behind it acts differently depending on the host. It makes it a complex puzzle.
Exactly. So that's our mission for this deep dive. Using this comprehensive overview we've got, we want to try and cut through that complexity, really understand it. We'll explore, what causes it, how it gets around, the signs which can be sneaky in different animals, and we'll touch on humans too, briefly but importantly. Then diagnosis, treatment, and crucially, prevention. How do we stop it?
And we'll definitely be digging into its global reach too. The impact on animal health, farming, public health. It highlights that interconnectedness we keep seeing, that one health idea.
Okay, let's start at the beginning then. Fundamentally, what is anaplasmosis? What are we actually dealing with here?
So at its core, anaplasmosis is an infectious disease. It's caused by specific bacteria from the genus Anaplasma. And the sources emphasize these are obligate intracellular pathogens.
Obligate intracellular.
Okay, let's pause there. What does that actually mean in simple terms for the bacteria?
Good question. It means they absolutely have to live and reproduce inside the cells of their hosts. They can't just, hang out and multiply on their own. Think of them like tiny burglars that need to get inside a specific house, a cell type, to survive and cause trouble.
Ah, okay, so they're hidden inside cells, which probably makes them harder to deal with. And you said specific cell types. They have favorites.
Precisely. Different anaplasma species show what we call tropism, a preference for certain types of blood cells in the host they infect. Okay, so which specific anaplasma species do we really need to know about from these sources, and which cells are their targets?
Well, first there's Anaplasma marginale. That's the main one causing bovine anaplasmosis, so in cattle. As the name kind of suggests, it likes to sit right on the margin, the edge of the red blood cells. It's a huge economic problem for livestock farmers.
Red blood cells. Okay, I can already see where that might lead in terms of problems. What's the next big one?
Then you've got Anaplasma phagocytophilum. This one's more widespread. It hits dogs, horses, ruminants like sheep and goats, and importantly, humans too. It goes after a type of white blood cell called neutrophils. They're part of our immune defense. That's why it's sometimes called granulocytic anaplasmosis.
And this is the one you mentioned can cross over to people.
Yes, exactly. Agocytophilum is the species that causes human granulocytic anaplasmosis, HGA, if a person gets infected.
Got it. And there was a third one, particularly for dogs.
All right, Anaplasmoplates. This one specifically targets platelets in dogs. Platelets are those tiny cells vital for blood clotting. So infection leads to something called infectious cyclic thrombocytopenia, basically a recurring drop in platelets.
Okay, so we've got the what these specific bacteria and the who, the animals and the cells they invade. How do these little guys actually get transmitted? How do they spread?
The main way, the overwhelming route highlighted in the sources, is ticks, biological transmission. The bacteria live in the tick's salivary glands, and when an infected tick bites and feeds, it injects the bacteria right into the host's bloodstream.
And just like the bacteria prefer certain cells, different tick species are the main carriers for different anaplasma species, right?
Yes, that's really key, especially for prevention. For Aphagocytophilum, the one affecting dogs and humans, it's mainly the black-legged, Ixodes scapularis. In the eastern and central U.S., out west, it's Ixodes pacificus. For Aplates in dogs, the brown dog tick, Rhipicephalus sanguineus, is the likely culprit globally. And for A. marginale in cattle, it's various dermacenter and Rhipicephalus tick species.
So knowing your local ticks matters, but the sources also mentioned other ways it can spread, didn't they? Particularly in livestock, which sounds a bit concerning.
Yes, that's a really critical point for anyone working with cattle. While ticks are number one, mechanical transmission is definitely a risk. This happens through contaminated instruments, things like needles, dehorning tools, castration equipment, even tattoo tools if they aren't cleaned properly between animals.
Wow.
And biting flies can potentially transfer it mechanically too, sort of like dirty needles, but usually only over short distances.
So it's not just about ticks out in the pasture. Hygiene practices on the farm itself can directly spread the infection.
Absolutely. And that ties into the seasonal pattern too. You see peaks in cases during warmer months when ticks and those biting flies are most active.
Right. Okay, let's talk about what happens after infection. What should people be looking out for? Let's start with cattle and A. marginale. You said red blood cells. Sounds bad.
It is. The absolute hallmark sign in cattle is severe progressive anemia. That's because the bacteria are destroying those oxygen-carrying red blood cells. This leads to really classic symptoms. High fever, the animal's incredibly lethargic, weak, loses weight, and you often see icterus, or jaundice, that yellowing of the gums, the whites of the eyes.
Yeah, jaundice is such a clear visual sign. Something is really wrong systemically.
It really is. And in older cattle or those more susceptible, the anemia can get so bad it's fatal. Sometimes, in really acute cases, you might even see aggression, probably due to cerebral hypoxia. The brain just isn't getting enough oxygen.
Gosh, that sounds awful for the animal. And the sources brought up a big challenge here too, didn't they? Animals that are infected but don't look sick.
Yes, the subclinical carrier state. This is a massive headache for livestock management.
Hmm.
You have cattle infected with A. marginale carrying the bacteria in their blood, potentially infectious to ticks, but showing absolutely no outward signs of illness. They act as a hidden reservoir, constantly posing a risk to the rest of the herd. The farmer might not even know they're there.
That makes control incredibly difficult. Okay, let's switch over to dogs. What about A. phagocytophilum or A. platus infections? What do they look like?
In dogs, the signs can be, well, more variable, often quite nonspecific. Things like fever, just being generally off, lethargic, not wanting to eat, maybe some weight loss. But one of the most consistent things vets find on blood tests is thrombocytopenia, that low platelet count we mentioned.
Low platelets. So potential issues with clotting.
Potentially, yes. While major bleeding isn't super common, especially with A. phagocytophilum, with A. plates, that cyclic drop in platelets can sometimes lead to noticeable bleeding, like bruising easily or nosebleeds. Other signs vets might see in dogs include lameness, joint pain, sometimes vomiting or diarrhea, maybe enlarged lymph nodes or spleen. And occasionally, though it's less common, you can even get neurological signs.
So it sounds like a real mix of possible symptoms in dogs. Makes diagnosis tricky without running tests, I imagine. And just quickly circling back to humans again, with A. phagocytophilum.
Right, for humans who get infected from a tick bite, the symptoms are often described as flu-like. Fever, headache, muscle aches, feeling really tired. Most people recover fine with treatment, but it can become severe, especially for people with weakened immune systems. So prompt medical advice is definitely important if you suspect it after a tick bite.
Okay, so you're a vet, you see these signs in a dog or cow, or a doctor sees those flu-like symptoms. How do you actually confirm it's anaplasmosis?
Yeah, accurate diagnosis is absolutely key. It's usually a combination of looking at those clinical signs we just discussed and specific lab tests. Standard blood work, like a CBC complete blood count, is often the first step. That'll show the thrombocytopenia, the low platelets in dogs, and sometimes cattle too. And in cattle, it will definitely show that anemia. You might also see changes in white blood cell counts or maybe elevated liver enzymes sometimes.
Can you just tell by looking at the blood under a microscope?
Sometimes, yes. Microscopy can be useful, particularly in the acute phase of the illness. For A. phagocytophilum, vets might spot these little clusters of bacteria inside white blood cells. They're called morulae. For A. marginale, they look for the bacteria right on the edge of the red blood cells. Seeing those is pretty strong evidence, but they aren't always present, or they can be really hard to find, especially if the number of infected cells is low, so you can't rely on just microscopy.
Okay, so what about tests that look for the body's immune response? Antibody tests.
Right, serology. Tests like ELISA or IFA are common. They detect antibodies the animal or person has made against the anaplasmobacteria. These basically tell you if the host has been exposed to the bacteria at some point in the past.
Ah, but there's a catch there too, isn't there? Exposure doesn't necessarily mean active infection right now.
Exactly that. A positive antibody test could mean a past infection that's cleared, or it could mean a current infection, or even recent vaccination in some cases for cattle. Plus, it takes time, days, maybe weeks, for those antibodies to develop after the initial infection. So in the very early stages of the disease, the serology test might still be negative.
Okay, so if you really need to know for sure, is the bacteria present right now, or you need to pinpoint the exact species, what's the best bet?
That's where molecular tests, specifically PCR, come in, polymerase chain reaction. PCR directly detects the bacteria's genetic material, its DNA, basically. It's extremely sensitive, so it can find even tiny amounts of bacteria. And it's highly specific, meaning it can tell you exactly which anaplasma species is causing the problem. It's fantastic for diagnosing early infections before antibodies show up.
Right. So PCR is kind of the gold standard for confirmation, especially for active infection. Okay, diagnosis sorted. What about treatment? What's the usual approach once you have a diagnosis?
So the main thing is prompt antibiotic treatment. That's really the cornerstone. For dogs and humans with aphagocytophilum or A. platies, the go-to antibiotic is doxycycline. Treatment usually lasts around 10 to 14 days, maybe longer in some cases, and it's generally very effective. Clinical signs often improve quite quickly. In cattle with A. marginale, oxytetracycline is the most frequently used antibiotic.
And I guess if the animal is really sick, antibiotics alone might not be enough. Supportive care.
Oh, absolutely. Especially with severe anemia in cattle or very sick dogs. They might need things like intravenous fluids to stay hydrated, anti-inflammatories for fever and pain. And in really critical cases of anemia in cattle, a blood transfusion might be necessary to save their life.
Okay, now here's something that struck me as really interesting, maybe even a bit frustrating, particularly for livestock producers. Does treatment always completely get rid of the bacteria?
Ah, yes. This is a really important point for long-term management. While the antibiotics are usually great at cleaning up the symptoms, making the animal feel better, the sources highlight a big challenge. Treatment doesn't always eliminate that carrier state, especially in cattle with A. marginale.
So hold on. A cow could be treated, look perfectly healthy, but still be carrying the bacteria silently, and could then potentially infect ticks which bite other cows.
That's exactly the problem. It makes herd management incredibly difficult.
Wow. That means treatment alone isn't enough to actually eradicate the disease from a herd.
Precisely.
Yeah.
You have to also focus on identifying and then managing or removing those carrier animals to stop the cycle of transmission. And that's obviously got huge logistical and economic implications for farmers.
Which really brings us back to prevention being absolutely vital, doesn't it? Especially since, as the sources mentioned, there isn't one single perfect vaccine that works for all species everywhere.
You got it. Prevention has to be about breaking that transmission cycle, and that primarily means tick control, plus management strategies that fit the specific situation. For pets, dogs, and cats, it's about regular tick checks, especially after they've been outside, promptly removing any ticks you find and doing it correctly, and using effective tick prevention products consistently. The spot-ons, oral meds, collars that your vet recommends.
And keeping your yard less tick-friendly helps too, right?
Definitely. Environmental control, keeping the grass short, clearing away leaf litter and brush where ticks like to hide, maybe even yard treatments in really high-risk areas. For livestock, it's usually a broader strategy. Applying insecticides or acaricides directly to the animals is part of it, but it also involves careful herd management.
Like finding and dealing with those carriers we talked about.
Exactly. Using testing programs to identify the subclinical carriers, and then deciding whether to isolate them, treat them strategically, or maybe even cull them to remove the infection source. And, crucially, strict biosecurity.
Biosecurity, you mean stopping that mechanical spread.
Yes, simple things, but so important. Not reusing needles or syringes between animals. Thoroughly cleaning and sterilizing surgical tools like dehorners or castration equipment every single time. Also, quarantining and testing any new animals before you let them mix with your main herd.
You mentioned some vaccines do exist for cattle, but they're not perfect.
That's right. There are commercial vaccines for A. marginale available in some regions, but their effectiveness can vary. And importantly, many are designed mainly to reduce the severity of the disease to prevent deaths, rather than preventing infection or stopping the animal from becoming a carrier. So they're another tool in the toolbox, absolutely, but they're not a magic bullet. They don't replace good tick control and management.
Yeah, that really hammers home that tick control seems to be the most crucial, universally applicable prevention strategy for pets, livestock, and even indirectly for us. Let's just revisit that zoonotic link A, phagocytophilum affecting humans. You stressed it's not spread directly from an infected pet, right?
Correct. And this is fascinating and important. The tick is the key intermediary. The bacteria gets transmitted from an infected animal, which could be wildlife like deer or rodents, or potentially even an infected dog, to a tick that feeds on it. Then that same infected tick has to bite a human to transmit the infection. It's the shared tick vector, not direct contact with the animal.
Ah, okay. So protecting your dog from ticks actually adds a layer of protection for your family, too.
Absolutely. If you reduce the number of infected ticks feeding on your dog, you reduce the chance of those same ticks potentially ending up on a person later. In fact, the sources mentioned that sometimes a cluster of canine anaplasmosis cases in an area can act as a kind of sentinel event.
A warning signal.
Exactly. It alerts local vets and public health officials that A. phagocytophilum-infected ticks are active right there, right then, which means there's an increased risk for people in that same area, too.
That sentinel idea really brings it all together, doesn't it? This whole discussion underlines that one health concept so clearly. How health of animals, people, and our shared environment are just completely intertwined.
It really does. When you look at the impact from big economic losses in cattle, serious illness in our pets, to the direct health risk for humans, anaplasmosis is a perfect example of an issue that needs that integrated, one health approach. You have to look at all the pieces.
We've definitely covered a lot. We've unpacked that anaplasmosis is caused by those specific anaplasma bacteria, spread mainly by ticks, but also mechanically, especially in livestock.
Yeah.
Presents differently, A. marginally in cattle, causing that severe anemia by hitting red blood cells. A. phagocytophilum and A. platies in dogs, often causing low platelets, targeting white cells and platelets.
And we talk a diagnosis, needing that mix of clinical signs, blood work, maybe microscopy, antibody tests, and crucially, that PCR test for confirmation.
Right. In treatment, doxycycline usually for dogs and humans, oxytetracycline for cattle. Effective for sickness,
But doesn't always clear that carrier state in livestock, which is a huge management challenge.
And always remembering, A. phagocytophilum is the one that can affect humans, but only via tick bite, not from your pet directly.
Exactly.
So, wrapping this up, what does all this mean for you listening? Well, whether you have pets, work with livestock, or just live somewhere with ticks, and that's increasingly more places, understanding anaplasmosis, what it is, how it spreads, the signs to watch for, it's really vital for protecting yourself, your animals, and maybe even your business.
Yeah, looking forward, the sources brought up something pretty significant to think about. They noted that tick populations and where they live might actually expand because of climate change. Which leads to the question, what could this potential increase in tick numbers and range mean for diseases like anaplasmosis in the future? How might that change the level of vigilance we need in areas where ticks are common? And how might we need to adapt our prevention strategies down the road? Something to keep in mind.